Good. So my name is Dr. Ivonne Pozerski. I'm a psychiatry consultant living in Waterford and working in Waterford Hospital. I'm also psychotherapist, so I have two qualifications, like proper medical qualification and training in psychiatry, in adult psychiatry, liaison psychiatry, and also in youth psychiatry. And also I'm a psychotherapist. I don't use my psychotherapy skills much in this role, but I supervise more doctors who do psychotherapy. I need somebody to control time because I don't want to use too much time. All right. When I came here, I brought a little book with me, and Colin was laughing at me because he said, "This is your Bible. This is Psychiatry Oxford Handbook," and it's everything. And why I brought it? I brought it here because part of my talk is about anxiety and fear, but also statistics. But just to start with, I want you to know that anxiety is very popular, is overwhelming, is like people suffer from this so often. And for example, schizophrenia is like probably 1% up to 2% of population. Affective disorders, so bipolar, depression altogether, so probably up to 8% people in the community, in the population. Substance abuse, this is more common. It goes up to 16%. But anxiety, it says in this book actually 15% of population has some kind of anxiety. Not only fear, which I'm going to talk about, but anxiety, like anxiety strong enough to classify as anxiety disorder. So something that needs to be addressed in one way or on another, which is huge number, is it? It's huge. Okay, and I was thinking how to present this anxiety and fear. So I was thinking about lion. So I think Jana covered this subject a bit. So she brought a picture of the cliff. Like if you have danger, straight, you face danger, there is an animal or situation that you respond in fear. So we talk about fear because it's physiological, it's short-lasting, you respond. And this is very interesting thing because you respond in a minute, in a second, yeah? But then to calm you down from this arousal, it takes much longer. Isn't it interesting? I feel it's very interesting because it's very quick to react, but then to bring yourself down to a baseline, like, you know, to relax and everything, it takes ages, yeah? And some people quicker than others. It depends on probably practice and their flexibility of their central nervous system. Okay, and this another statistics. Yeah, I put it here because I was thinking, oh gosh, it's so common. It's so common. Look, generalized anxiety up to 6.5.
That's you, and that's it.
Yeah, yeah. Agoraphobia is. I will talk more about the specifics, but you can see panic attack. No. It's more about this. I want to talk. Yeah. Oh gosh. No. Okay, good. Yeah. So, so panic attacks are very common. Panic attacks are so common, they might. Okay. The statistics say up to 9%, but actually to experience panic attack, only panic attack in your life, it could be even 25% of people have experience of having panic attacks in their life. Yeah, so this is so often. Yeah, back one, this one back here. Yeah, so why I'm anxious? I'm anxious because that's my response, but this is the model, CBT model, why people are anxious. And the model says that actually the thoughts that we have go first, and then we react in our emotions, and then we develop body symptoms, and then we behave in such way. For example, avoiding some certain situation. Or living room or something, this is so common. So CBT models tells us that actually thoughts, our worries are first. So this actually comes very quickly. It's like almost all together. Like you think, but you are not aware that you're thinking. Yeah. So there's thoughts. There could be memory, it would be picture in your mind, it would be smell, something, but still is we call it thoughts, and then you react in certain way. So we anxious, we fearful, and then we have body symptoms because our body reacts to body symptoms. Either there is symptom if we're anxious, so we have all the symptoms that Jana was talking about heart palpitation, a lot about our chest, but also a bit of confusion because we feel, oh my goodness, I can't feel clearly. Yeah, I can't feel clearly. I feel I don't have control over myself, over the situation, but also myself. So this is body. I put this body symptoms. It's not like it's not only body, but also my mind, and then behavior. So I do something about this, yeah, because I feel so uncomfortable. I can leave. I can tell somebody I do this and that, yeah, as a response to all this what's happening. So the most common anxiety disorders here. So probably the most common is panic disorder, yeah, because there is a quite high number of people experience this in their lives. And when I was talking about statistics, it's like panic attacks are so common, but in some settings are even more common. So in cardiovascular clinics, so they research patients who come for a kind of a heart or blood pressure or vascular problems, and they discovered that actually up to 65% of these people who come with physical symptoms, they reported panic attacks. Yeah. Another in neurology, again in neurology clinics, a lot of people who came with, let's say, dizziness as a primary complaint, doctors discover or researchers discovered that actually there was panic attacks behind this. So this is so often. I wanted to let you know that this is often, and that if people suffer, they are not on them. They are not unique in this. There are plenty of people like this, because people who experience panic attacks, they feel, oh, I'm different from others. No, they are not. So this is common. But we're talking about panic disorder when it happens not once. It happened not once. It happens few times. and people are afraid of these panic attacks coming again, and it affects their functioning. So this is why we talk about panic disorder, not single one panic attack that somebody had when walking the street and had all of the sudden pain in their chest, and they were thinking this is heart attack, but wasn't. And generalized anxiety disorder, very similar, but it's more about feeling on edge, feeling anxious all the time, not to extent of having panic attacks, but also here with generalized anxiety, you have worries, constantly worries. When you talk to people, they would say, you could ask them like, how much time do you spend on worries? And they would say 90% of my time, 80% of time. So they worry constantly. And then obviously the body responded with anxiety. Agoraphobia, one of the specific phobias. Actually, I brought this book to show you. This is the list of common phobias. Yeah, this is the list. And people can be afraid of many things, not only planes, but or dogs, or hair, or vomiting. You know, a lot of things. So agoraphobia is when you feel when you anxious to go to places when you don't feel safe. So agoraphobia could and with people avoiding leaving their places, leaving houses. And there are people like this, and patients. I saw a patient just recently who said, I haven't been able to leave my house for years. But this particular patient was able to walk around house, but didn't leave the property, like the. Yes, absolutely. So this could be very like affecting functioning, and could be very difficult. Social phobia, another one. Yes, social phobia, very popular nowadays in young population. And we see anxiety more and more prevalent in young people, in children, and especially young people. Onset of social phobia could be a teenager, because they start to see themselves and compare to others. And again, very common thing, not only with girls, but also with boys. Consequences, they don't go to school. They avoid going to many activities, they self-isolate themselves. And again, because with social media, we feel, that's fine, because they can connect with people who they know from Facebook or Instagram. No, the life is about going out. I put this obsessive compulsive disorder. This is not common. This is 1 to maybe 3% of population, but very disabled. So people could be obsessive compulsive. So they have obsessive thoughts of, for example, being contaminated with germs, bacteria. So this could lead to obsessive cleaning, obsessive checking, very difficult disorder, but not so often. But still, the patient that I saw lately was a patient who was admitted with a health condition, and she spent a lot of time in the morning and in the evening cleaning her bed and bedside table. But removing everything from bedside table and cleaning drawer, and cleaning railings, everything for hours. You could think that in the hospital you don't have much to clean. It's your bed and your bedside table. But yeah, this particular lady spent a lot. Okay, there are more. I put only few, but there is again few like a list of anxiety disorder. Yeah. What we can do, because I'm psychotherapist, but also psychiatrist, so I'm going to talk a bit about pharmacology. So, medications. Look, I'm both. I'm psychotherapist, I'm a psychiatrist, and still I believe there are situations that people need medication. You can't solve any problem only with psychotherapy, even though I really believe in psychotherapy. I know it's effective, it works, but there are situations that no, you need medication. What there are situations? The situation when psychotherapy is very effective, but it takes time. You can't expect after 1, 2, 3 sessions to get much better. You're still going to be better, but and you suffer, you feel awful, you're anxious all the time, you just can't function like this. So in this situation you need medications, and I still believe that there are medication for to help people. So there are some of the medication, SSRI, SNRI, so probably the most popular from the first group is Prozac, fluoxetine, very popular for young people, young population. Sertraline is another one, so people are familiar with the names. Prozac was the first SSRI introduced in 80s, 90s, 80s.
Go with me.
No?
My pharmacy days are gone.
I think it is very popular.
Less side effects.
Yeah, but we have group of SSRI and they're very effective. But people need to take them at least for two weeks to see the first sign of improvements. So from my perspective, I feel the most effective way is to combine pharmacotherapy with other forms of therapy. And then when people gain control and feel better, a psychiatrist or GP can reduce medications. If people rely only on medications and they don't do any work with anxiety, they will stay on this medication for life. But we don't want this to happen. We want them to recover, to acknowledge, okay, I suffered from, let's say, panic attacks, yeah? But now I don't. Benzodiazepines, introduced in 70s. Yeah, okay, we're going, yeah. Again, when they came, this was a huge hope. Oh, we have miracle. But then very quickly they discovered, oh, they cause addiction. So again, very effective, but for first treatment to reduce the symptoms, to allow somebody to go to psychology and talk or do other things. Sometimes antipsychotics, yeah, sometimes other medication that we have. Other forms of therapy. So Jana was talking about CBTs. There are other. Sometimes family therapy. If you have somebody young and there is kind of a problem in family, so maybe systematic therapy is the answer. Mindful group therapy. There are group therapies for anxiety. Meditation. So Jana was covered this as well. And then at the end, I brought this Serenity Prayer. I brought this because I was thinking this is good to finish with. Dear God, Grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. I'll tell you one thing more, probably. So sometimes I see people who come to see me, and when I explore, they complain about anxiety and everything. But Jana was talking about this, but they, for example, they live in very toxic relationship. Yeah. And I remember, look, I met this lady many years ago, and I still remember her. She came to me and she said, "Doctor, give me something. I want to feel better," she said. Okay, I explore, and she said, my husband has affair, and she said, I'm happy, I can cope with this, but I need something to relax me, with anxiety. What you would say? Just go and do something with this relationship. It's not easy. I know, I'm human being myself. It's not easy, but sometimes you can change your circumstances. But on the other hand, if you can't, because there are things like people come and they would say, "Oh, I need to take care of my sick father, and he's awful to me, but he's dying or something." So you can't change this. But if you can accept and get some help from professionals, but also from church, yeah, maybe. So you know that you building your strength, stamina to stay. There's another part like, and wisdom to know the difference, to know what I can change about myself or about my life, and what I can't for many reasons. Okay, good. Thank you. Thank you. Good, I hear. Yeah.